Jake here from IBPF. Thank you for joining today's webinar on the topic of social rhythm therapy for bipolar disorder. We are honored to be joined by Dr. Holly Swartz, who serves as a member on the IBPF Scientific Advisory Board and is professor of psychiatry at the University of Pittsburgh School of Medicine. We encourage you to read Dr. Swartz's full bio at ibpf.org. And I do want to let everyone know that there will be a question and answer session at the end of the talk. You may type in your questions at any time throughout the presentation. Dr. Swartz, thank you so much for joining us.
Thank you for inviting me. I'm really pleased to be here. So I'm going to be talking about, as Jake said, social rhythm therapy, which I'll refer to using shorthand as SRT for bipolar disorder. So hopefully you all can see my slides. Here are my disclosures. The only really relevant one here is that I'll talk on and off about a workbook that I recently published on social rhythm therapy that's published by New Harbinger Publications. And although I haven't seen a penny from them, I will expect to eventually receive some royalties from that. Okay, so what am I going to do? I'm going to talk briefly about why I think psychotherapy is important for bipolar disorder. I think this is preaching to the choir. I imagine this audience is already buying into that idea, but I'll mention that briefly, and then I'll talk about SRT. What is it? In particular, what are circadian rhythms and body clocks, which is what we're targeting with social rhythm therapy. And although this isn't, a how-to training for SRT, I'll touch on sort of some of the key strategies that we would use in social rhythm therapy to give you a sense of what this is all about, and maybe you can pick up a few tips for yourself or for a loved one along the way. Okay, so let's start with the whole concept of psychotherapy for bipolar disorder. As we all know, this is a biologic illness. We have good medications for managing bipolar disorder. We could get some better ones, but nevertheless, we know that medication is a mainstay of treatment. So why are we talking about psychotherapy or psychosocial interventions? And I always like to quote Kate Jamison, who lives with bipolar disorder, and she wrote a really brilliant autobiography about her lived experience, An Unquiet Mind. And she writes, "I cannot imagine leading a normal life without both taking lithium and having had the benefits of psychotherapy. Ineffably, psychotherapy heals. It makes some sense of the confusion, reins in the terrifying thoughts and feelings, returns some control and hope and possibility of learning from it all. It is where I have believed or have learned to believe that I might someday be able to contend with all of this." So I think, Dr. Jameson says this certainly better than I can. I'm a researcher. I do research in psychotherapy, so I'm always interested in what the evidence tells us. Without going through this in detail, we have good evidence to show that psychotherapy helps manage bipolar disorder, both in terms of addressing the symptoms of acute depression in particular, and preventing the onset of new episodes. And this is a table from the CANMAT guidelines, which are guidelines that those of us who work in this field rely on heavily. And you can see that there are several evidence-based psychosocial interventions for bipolar disorder that have largely level 2 evidence, which is typically randomized controlled trial data, and are recommended for the management of bipolar disorder. And I'm going to be talking about the fourth one on this list, interpersonal and social rhythm therapy. And actually, I'm going to be talking about a variant of interpersonal and social rhythm therapy. So interpersonal and social rhythm therapy, or IPSRT, was developed at the University of Pittsburgh by Ellen Frank, who I had the great pleasure and honor of working with for many years. And it combines strategies from interpersonal psychotherapy, which is an evidence-based treatment for unipolar depression, with a behavioral strategy, social rhythm therapy, or SRT, which targets disruptions in circadian rhythms that we know are part of the underlying biology of bipolar disorder. And in particular, the strategy emphasizes the link between establishing regular routines in order to stabilize moods, and uses something that I'll talk about called the social rhythm metric to monitor and to modify daily routines. And so over time, we have tested social rhythm therapy on its own, apart from the IPT component, in part because it's shorter, and in part because we have data now showing that it is an efficacious treatment for addressing acute depressive symptoms in the context of bipolar disorder. And there's ongoing work in this area. So I'm going to actually just be focused today. I'm going to focus on the social rhythm therapy part of this, which can be administered in the context of IPSRT or as a standalone treatment. So in order for us to think about SRT, we first have to pay a little bit of attention to circadian rhythms and body clocks, which are key concepts that we're going to be targeting with this intervention. And as you all know, of course, rhythms occur throughout nature. So these are predictable, recurrent physical activities or forces that follow an expected sequence, and you know like what's going to happen next because you know what happened before. So the tides, the rising and the setting of the sun, the circle of life. We also see rhythms in things like music. Rhythms are ubiquitous. This is part of how nature functions. Circadian rhythms are a subset of these naturally occurring rhythms. They actually occur in virtually all species, not just animals, but also in plants. And they help to anchor our biology. So they're biochemical, physiological, behavioral processes that follow an approximately 24-hour cycle. So that's where the name circadian comes from. So circa is the Latin word for approximately, and dia is the Latin word for day. So approximately 1 day in length, but it varies a little bit. And it varies because the systems are responsive to external cues. So the hallmark of circadian rhythms is that they persist in the absence of cues. That is to say, they just keep on going, just like, the rising and the setting of the sun. It just keeps going. But they're also influenced by external stimuli. So we often talk about entraining circadian rhythms to external factors. And this means that this system is both autonomous, it kind of keeps on trucking by itself, and responsive to environmental input. And the word that circadian researchers use are zeitgebers. So it comes from the German word, words that mean timekeepers. So these are factors that help to set our biologic clocks and keep it running much closer to 24 hours than sort of the drifting towards a little bit longer than 24 hours, which is how the autonomous circadian rhythms run. And so we'll talk a little bit about zeitgebers as we go along here. But I just want to sort of make sure that we're all on the same page in terms of how this works for all of us, right? So we all have a sort of biologic rhythm, and you probably are aware of it because you're probably aware that you typically sleep at some time of the day and are awake at other times of the day. You may be a little bit less aware of some of these other processes that are percolating in the background, but we also know that like our core body temperature varies over the course of the day, lowest in the early morning, highest in the early evening. Things like our cardiovascular efficiency, like our muscle strength. So you'll get a better workout if you do a cardiovascular workout like at 5 in the afternoon versus 6 in the morning, which doesn't mean to say that if it's good to fit it into your schedule no matter how, but this is probably related to our biology. So our ancestors were probably tracking prey and hunting in the early evening when many animals are very active. So our bodies are synchronized to our geophysical environment by a host of processes that are running in the background and help us efficiently cohabitate with our environment. One of the key components of this is a hormone that you are all familiar with, melatonin, which is the sleep hormone. And this is an important factor that keeps our sleep-wake cycles running smoothly. And there's a sort of central command post for circadian rhythms in the brain. This gets a bit technical. It's called the suprachiasmatic nucleus. That doesn't matter too much, but I think what does matter is knowing that there are pathways directly from the back of the eyeball into the brain that helps give information to the brain about when it is in time, which is to say, are we perceiving light? Are we perceiving darkness? And that helps tell our brain, oh, it's dark out, or it's getting dark. I should probably start making some melatonin. And the melatonin, as it bathes our body, helps us get ready for sleep and ultimately to stay asleep. So this is a system that is getting input from the outside world, is located in the brain, and affects all of our physiologic function. And this is a really confusing slide, and I'm not going to go into it, but except for to say that the molecular mechanisms of these circadian processes have been pretty well established, and there are a whole bunch of genes and proteins that are controlling our circadian function. But the upshot of this is that the circadian rhythms of our body, or our body clocks, are communicating with tissues throughout our body. And so although the main pacemaker is located in our brain, it's sending signals to all the organs in our body, and vice versa. The organs in our body are sending information back up to the brain, again, about when it is. So an example might be the gastrointestinal tract, or your stomach, is linked to your brain. So when you eat something, you're basically telling your brain, oh, it's breakfast time, or oh, it's lunchtime. And this is important. We're going to leverage that information as we go along to talk about ways to keep our brain or our body clocks on track by using all sorts of inputs from our daily activities that help shore up the stability of our central body clock. So just a couple other concepts before we get into how we do that, how we actually implement social rhythm therapy. There's just a couple other things that I think are worth knowing about. One is the whole idea of chronotype. So you probably know this about yourself. Some of us are morning larks. We're up and at 'em early, and some of us are night owls. We, really come to life late at night, and really are dragging in the morning. And this is called a chronotype. And some of us are in between. We're neither larks nor owls. And we know that people with bipolar disorder tend to be owls. Not across the board, but many folks with bipolar disorder find that they're just much more alert and active in the evenings, and have trouble getting going in the morning. This does tend to be genetically conserved. It tends to run in families. And it's helpful to know what your body clock and chronotype, what your chronotype is, so that when we start to think about strategies to regulate our body clocks, we pay attention to our own unique biology, because it's really hard to fight that. And so it might be better to sort of work with your chronotype rather than against it. And so we'll talk a little bit about that as well. Here's a fun fact. There's a great website called CET.org, so Center for Environmental Therapeutics. And you can you can log on there and take a little test and find out what your chronotype is. And they've got lots of great resources on circadian rhythms and body clocks. So highly recommend that website. Okay, so what does this mean for mood disorders? So it's important to know, first of all, that circadian rhythms are core biologic processes and are relevant, as I like to say, to anybody with a brain. We know that disruptions in circadian rhythms negatively affect all sorts of, because this is a whole body issue, right? It affects all sorts of physiologic processes. So disrupted circadian rhythms are implicated in mood disorders, and we'll talk a little bit more about that in a minute, because obviously that's a focus of what we're talking about today. But it also has an impact on our cardiovascular function. It increases risk for diabetes, for obesity, for migraines, for certain types of cancers. So basically, having dysregulated rhythms is just bad for human beings, and having more regular routines is good for both mental and physical health. And so this social rhythm therapy has been systematically tested in bipolar disorder and depression, but probably is useful for a host of physiologic processes. So there's like a lot of information about the effects of circadian rhythms on mood. Again, without going into all the details, there are, for instance, animal models of bipolar disorder that involve changing some of those genes that have been identified as central to circadian function. So one of those is called the clock gene. And so when researchers take put mutant versions of the clock genes into mice, those mice then sort of display manic-like behaviors. And some of the medicines that we use to treat bipolar disorder, such as lithium, can reverse that behavioral phenotype. Again, pointing towards these changes in the circadian genes as potentially a part of the origin story of bipolar disorder. And there's a lot of other sort of circumstantial evidence as well. So we know that that there's a lot of overlap between circadian function, sleep, and mood. We know that if you have bipolar disorder, that either during a depressive state or a hypomanic state, you're more likely to have higher levels of cortisol secretion than individuals who are not affected by bipolar disorder. Again, so melatonin is typically the sleep hormone, and cortisol is the alerting or wakeful hormone. So we see changes in melatonin secretion if you have bipolar disorder, and as I mentioned in the animal models, we know that several of the medications that we use to treat bipolar disorder can stabilize circadian rhythms. On a neural circuitry level, we also know that the regions of the brain that affect mood, particularly the regions of the brain that control dopamine and serotonin, are under circadian control, and that when you disrupt your circadian clock, you get disruptions in dopamine and serotonin function, and that's likely one of the several ways that disruptions in circadian rhythms contributes to mood disorders. So focusing on the behavioral aspects of this, what happens is that you have when your body clock gets disrupted, you have a mismatch between the external clock, what the clock on the wall says or the clock on your phone says, and what your brain's body clock shows. And again, this is common to all human beings who have brains. But if you have bipolar disorder, you may have a special sensitivity to this disruption in body clocks. And so you may be more vulnerable than somebody without bipolar disorder to getting off track and experiencing this mismatch between what's happening in your body clock versus what's happening in the external world. And lots of things can get us off track. So if you do shift work, changing seasons, when we change the clock from daylight savings time to standard time, or vice versa, when you travel across time zones for work or for pleasure, all of these things dysregulate our body clocks and cause a mismatch between what our body clocks say the time is and what's happening in the outside world. And again, most people feel pretty terrible when this mismatch is happening. If you have bipolar disorder, you're especially vulnerable to these chronobiologic changes, and it's harder to reset your body clock to align with the external clock. So those sort of transient feelings of bad sleep, stomach upset, poor concentration, irritability, all that stuff that happens to everybody when your body clock and the external clock are mismatched, that can persist if you have bipolar disorder. And so these chronobiologic challenges are especially important to pay attention to in order to stabilize bipolar disorder. We also know that light, we've been talking about this, is a really potent force in terms of keeping the circadian clock running smoothly. Again, evolutionarily, we're primed to respond to light inputs from the rising and the setting of the sun. That kind of helps everything stay real stable and on track. But in the post-industrial world, we're all exposed to light at the wrong time of day. So light at night, our brains aren't programmed to understand what that means, because our brains are thinking, oh, it's daytime. It's like, no, it's night, but I'm just checking my phone, right? And so this causes all your body clocks to go kind of haywire. Again, if you have bipolar disorder, you're much more vulnerable to these light insults than somebody without bipolar disorder, although it's true, as I said, for anybody with a brain. And things to keep in mind are that blue spectrum light. So those are that's short wavelength light, high energy light. That's part of the visible spectrum. That seems to be the main culprit, or the main agent in keeping our brains awake. So blue light exposure is good during the day, keeps us alert, active. But at night, it also really suppresses melatonin. And I'm sure you've heard about this, blue spectrum light is emitted by all of our screens. So if you're, flipping through, social media, or you're watching a video on your computer, you're bathing your brain in blue light, and you're basically telling your body clock, hey, it's daytime, and it's suppressing melatonin. And this has been associated with mood disorders, as well as I said, other physical health consequences, poor health, obesity, metabolic dysfunction. So this is a problem that we're all facing, and we'll talk a little bit about how to manage that. So one other concept that is important to social rhythm therapy is the idea of social zeitgebers. So I already mentioned that zeitgebers are timekeepers. These are external factors that keep the brain ticking smoothly. These are things that serve as anchors for our brain to tell us when it is. And as I mentioned, the prototype, and this is what we're evolutionarily programmed to pay attention to, is the rising and the setting of the sun, these kinds of geophysical environmental cues. But as I talked about, in the post-industrial era, we're not, probably most of you are not getting up when the sun rises and going to sleep when the sun sets. There's a whole other set of factors that are influencing our daily routines and rhythms. And so we call these social zeitgebers. And these are social factors that help to set our circadian clock. So it might be caregiving responsibilities that you have, or interactions with people who are close to you, or expectations that you show up at a job at a certain time. So there are a host of factors, these social zeitgebers, that are really important in setting our body clocks, especially in the setting of less geophysical inputs from, say, the rising and the setting of the sun. And so social rhythm therapy is going to focus on identifying these social zeitgebers and helping you develop regular social routines in order to stabilize underlying disturbances in your circadian rhythms and in your body clocks. And I just like to give this example. I use this when I'm training therapists, this is a particular way of seeing the world. So this little cartoon here shows an older woman who has recently lost her spouse. They've been together for 60 years. And in psychotherapy, most of us would want to address the grief associated with this loss. And that's absolutely important. And it's really important that we attend to psychological events that affect how we feel, that affect our mood. But the message from social rhythm therapy would be that in addition to exploring the psychological effects of this kind of event, we also really need to pay attention to the social rhythm effect of these kinds of losses. So you could imagine that this woman uh, no longer having a partner, is getting up at different times during the day. Maybe she used to make breakfast for him and now she doesn't have anybody to make breakfast for. Maybe they went for a walk and now she's got, midday, and now she doesn't have anybody to go on a walk with her. Maybe they watched, a video or a television program together at night and now she doesn't have anybody sort of keeping that schedule going. And so in terms of brain health, the loss of these social zeitgebers is also really important to pay attention to. That when you have a loss, there's a psychological component to it, but we also have to pay attention to the social rhythm aspects of these events and address them in order to maintain stability. So how do we do that? So what are the goals of social rhythm therapy? So I've sort of been talking about this as I'm going along. We want to stabilize daily social rhythms that have an impact on the underlying circadian biology. And we want to understand how this affects mood, because disruptions in circadian rhythms and social rhythms have a negative impact on mood. And conversely, stabilizing these systems can help to stabilize mood. And so we do a whole bunch of things to help people develop awareness of early warning signs, things that cause chronobiologic disruptions, and activities that people can take in order to protect their circadian integrity. And so one of the key elements that we use in social rhythm therapy is something called the social rhythm metric. Basically, the social rhythm metric consists of 5 items. I'll show you what it looks like in a second, that we ask people to pay attention to. And these are evidence derived, actually. So there was an older version of the social rhythm metric that was 17 items. And through our research, we were able to show that actually 4 of these accounted for most of the what we call the variance in outcomes in terms of protecting people against new episodes of bipolar disorder. And so it's actually the first 4 items: the time that you get out of bed, the time that you first have contact with another person, the time that you start your usual activity, whatever that is: school, housework, volunteer work, family care, whatever work, the time that you have your dinner. The time that you go to bed was added in because it just like it's nonsensical to talk about sleep schedules without monitoring bedtime. So that was added back in, but it's actually the first 4 that had the most impact in terms of protecting people against mood episodes. And then we assess mood and energy and look at the relationship between mood and energy. And this is what this thing looks like. The workbook that Jake mentioned has copies of that. It's all there's a link. Actually, there's a website where you can download copies of this. It's pencil and paper. There's some we could talk about efforts to automate it, but in general, we use this as a pencil and paper thing and ask people to track the time that they do each of these 5 activities, and then rate mood and energy. Typically, we use a -5 to +5 scale. But you could probably use whatever scale you wanted. And we looked at patterns over time. And you can see there's a column there for target times, and we'll talk about that. But we first just kind of monitor things to sort of see how stable or unstable the routines are, and then use target times to gradually bring these routines into greater regular alignment. And hopefully we see improvement in mood and energy as we go along. So this is kind of like the beating soul of social rhythm therapy. I'll say a couple words about like what we mean by out of bed. And again, this is all in the book that I just published. If you work with an IPSRT therapist, they would talk you through this. But basically, we're interested in the time that you're feet hit the ground and that you're vertical. This is based in biology because we all have sensors in our blood vessels that essentially tell the brain whether you're vertical or horizontal. And so if you just wake up and are lying in bed, it doesn't give the same kind of input to your brain that you've started the day. So we're tracking the time that you're out of bed for at least 30 minutes and vertical. We're not counting these kinds of, when you wake up, which may be different, that may be important to track. But this is what we're looking at. First contact with another person. We're social beings, and so the social contact also is important. Here's a bunch of tips. Generally want these to be reciprocal interactions, in person ideally, but if it's kind of in real time, doing it through electronic communication, that's probably okay. We don't generally count animals that jump on your head in the morning, but we could argue that point if you wanted to. I'm a big cat lover. The time that you start your usual activity. So part of this work might be finding a usual activity. So if you've really struggled with depression, let's say, and you really have, been going through a period of time where you're not doing much, what are some things that you could do at the same time every day just to start getting yourself back on track? And so this idea of regularity is really important. So, might you be able to, walk down to the end of the block and back, at the same time every day? That's a good one because you get some light exposure as well. Or maybe you could commit to, having a phone call with somebody at the same time every day and listing your social supports. Or maybe you're, up for doing more like volunteering or looking for employment. But again, the idea would be like, let's try to figure out something you could do every day at the same time. Bedtime, again, we're looking at inputs to the brain. So we want you to be lying down. We want the lights out. If this is happening like at 3 p.m, we would count that as a nap. We'll talk a little bit about napping. These are some examples of how we would define these anchors. And as I said, we typically use a -5 to +5 scale, with 0 being, sort of stable, euthymic in the middle. That, often works for folks who have bipolar disorder. If you don't have bipolar disorder, you might prefer like a 1 to 10 scale. I mean, it doesn't really matter. The idea here would be to do some systematic tracking so you can look at the relationship between the regularity or irregularity of your routines and your mood, and sort of see the connections there. And so it ends up looking something like this. I'm not going to kind of go into it. Let's just, the only thing I will say is like, let's look at the very top line. There's this has been sort of modified a little bit to distinguish between time awake and time out of bed. And you can do that, if you've got some issues that you're struggling with. So this person, is waking up at 9 or 6, but then not getting out of bed. But we know that that's not helping our brains. So like, can you shorten the time between the time that you wake up and the time you get out of bed? These might be things that we would work on in social rhythm therapy. And you can see at the bottom in the mood ratings, like the mood ratings are kind of low. Like this is having an impact on how this person is feeling. So, and there are no target times set yet. That's fine. We want to sort of get the lay of the land. And then we would start to work on establishing targets. And so, I'm going to talk a little bit about goal setting. So, part of this is kind of coming up collaboratively, or if you're doing the workbook, it kind of talks you through different options for setting manageable, initially small goals. The idea here is you don't want to be all over the map. The whole sort of mantra of social rhythm therapy is same time every day. So you want to find something that you can do as a first step towards that and see how it affects your mood, right? And so for instance, somebody might say, okay, my goal this week is I'm going to try to get up at the same time every day. That's a great social rhythm goal. And you might set like, your goal for time out of bed for 10 a.m., let's say. So the tip here is don't try to get up earlier than usual. The goal at the beginning especially is just to do it at the same time. You may eventually want to move it back, but again, the whole idea here is regularity. another goal, again, I wouldn't do them both, but maybe your goal would be, I want to start my daily activity at the same time every day this week. So a big problem that many of us struggle with is, the week looks good, but then the weekend you've got nothing to do, no reason to get up. And so doing some strategic planning for what you could do on the weekend that would anchor your day, so that you're getting up at the same time on the weekend as you are on the week. Because many people have that, we call that social jet lag, where there's a mismatch between your weekday schedules and your weekend schedule. Meals are important. I mentioned that earlier because it's again, there's circadian sensors in your stomach, and it's telling your brain, when you have dinner, okay, well, it's getting, this is part of the sequence that's getting us ready to sleep. And so people are like, I can't be bothered with dinner, or, I don't even have the motivation to cook anything. Well, so maybe the goal would be, I'll eat dinner at the same time every day, but dinner could be, just a small snack, or maybe you could engage your social support and use that also as an anchor so that you're having meals with somebody. The other one that's a big one, a lot of people say, okay, I'm going to go to bed at the same time every night. And that's what we're trying to get to, but it's very hard to make yourself fall asleep. It's the place to start is often your wake up time. So if you're struggling to fall asleep at night at the same time, the place to start actually is getting up at the same time every day, and doing more and more activities at the same time every day, which again will help your brain settle down. Just some tips. Again, there's lots of tips in the workbook. If you're working with an IPSRT therapist or an SRT therapist, we have lots of tricks up our sleeve. One thing that we'll often talk about is we don't want you to change your target time by more than like 30 minutes a week, maybe 15, because you don't want to cause your brain to have jet lag, right? Like, so again, if your wake up time is around 10 in the morning, but you really want to get up at 8, if you all of a sudden shift your wake up time to 8 in the morning, you're basically going across 2 time zones. It actually causes more problems than it solves. So you got to be really mindful of doing these things very gradually. And as I mentioned, time out of bed is really important because it really sets your circadian clock for the day. And so if you have no idea where to start, a good place to start is always with time out of bed. And it's something that, you can work on. I mean, there's a bunch of tips to try to figure out strategies to get out of bed if you're struggling with that, but consistent time out of bed is always a good place to start in terms of circadian health. This is just a little slide that just shows that, so this is a couple people, this is an IPSRT versus a control condition. And then when we start doing this, circadian rhythms become more regular. We can measure that. And so when we do these kinds of interventions, we can get more regular routines. And as I said before, that the regularity of routines, or maybe I didn't say before, but in our research studies, the regularity of routines is what mediates or is driving the outcomes in bipolar disorder. Longer time to new episodes, shorter time to recovery from episodes. Of course, this is behavior change, right? And so, we also have to do a lot of problem solving around difficulties doing this. Like if this were easy, like it's like losing weight or stopping smoking. It's like this, making, changes in our habits is super hard. And so changing our routines is also really hard. And so I think, there's lots of troubleshooting that we do around that. This is like a checklist from, I have the reference for the Social Rhythm Therapy Workbook that I've mentioned, and sort of identifying what some of the barriers that you might be experiencing to your target times, for instance, and we do some problem solving around it. So sometimes you set unrealistic times. It's like, no way am I going to do this. Actually, it's aspirational. Let's not, or I have no control over my meal times, or we try to stay within a 45-minute window. That's our goal for consistency. Might be struggling to do that, or feeling overwhelmed, or, some people have no problem with this at all. And, this is, not a huge challenge, but this is an example of some of the barriers that we might identify. And then we have a whole host of strategies to address that here. A couple ones. Again, this is all, it's elaborated in the workbook, but use your social supports, break these tasks into smaller pieces. If you're having trouble like doing the whole thing, just do a little chunk of it. Sometimes, we do want to try to be consistent across the week, but sometimes a good starting place is just a couple days. Can I just get up at the same time for 3 days this week and see how that goes? Just start where you can do it. Make sure you just focus on one thing at a time. It can get really overwhelming to try to do too many of these goals. Always pay attention to your mood and energy rating, because the idea here is if it helps, then that might be a motivator to try to do a little bit more, to stick with it. If it's not helping, maybe you need to rethink what your goal is. So it's a really good way to, sort of track what's going on. Coaching helps. Like, we all respond to supportive accountability, right? So like, if there's somebody else who wants to do this monitoring with you, and can you do it together and kind of, go back and forth on brainstorming and seeing how you're doing. Setting some rewards for yourself if you meet your goals. Can you download a video that you really wanted to watch, or meet up with a friend to go to a park that you've really been eager to see. It was something that that just makes you feel like you've accomplished something, because you have. And then ultimately, look, if you're struggling with a mood disorder, sometimes this stuff is just too hard. And it's really important to practice self-compassion and recognize that, maybe when you're feeling better, you can take another stab at it, but just don't beat yourself up about this stuff. It's hard. Just really quickly, there's a bunch of other strategies that we use besides focusing on the social rhythm metric and setting SRM goals. Just to kind of give you a taste for some of these, we do a lot of work around sleep hygiene, which these should be concepts that are familiar to you. Things like, making sure that you set up your environment to optimize sleep, addressing noises. You want to make sure it's dark, right? Thinking about stimulating either substances that you ingest or stimulating interactions that might interfere with sleep. So, making sure that we protect our brains to optimize sleep. And also during the daytime, we want to stimulate our brains, get exposure to light, get activity, interact with other people. So we want to help our brains have that distinction between night and day to optimize our daily routines. I'll say a word about napping. We're quite mindful of the fact that napping can decrease our drive to fall asleep. And so, especially if you're just, feeling depressed and don't have much energy, I think there's often a real urge to nap. And then that can then throw your whole sleep schedule off. So we've discussed a lot about sleep biology, but generally the rule of thumb is, to try to limit naps if possible. If you have to nap, a very short nap, maybe 20 minutes, and in a relatively early in the day, between 1 and 3 o'clock is probably okay. But just be careful about that, because that's something that can disrupt our sleep schedules and throw our daily routines off. If you nap and have no problem with your mood and your sleep or whatever, fine. But this is if you're really struggling. It's helpful to think about whether naps might be causing some of the trouble. The other thing, and I mentioned this earlier, is blue light exposure, and just social media in general. There's some interesting data that people who spend more time on social media actually just get less sleep. And it might be the kind of just you get that rabbit hole down social media and you just don't go to bed, or it might be that it's too stimulating, makes it hard to fall asleep. But it also might be the exposure to blue light. So generally, we want to encourage people to participate in a digital sunset and limit online activity, ideally an hour, 2 hours before bedtime. I know that there's a real temptation to scroll right before bed, but you want to be careful about that. And you can use some technology to beat technology. So there are programs that you can install on your devices to extract some of the blue spectrum light, and that can help. You can also purchase like dense amber glasses, basically you should be able to look at like a Bunsen burner or like the gas stove if you have, a gas oven and not see blue. So they actually have to be pretty opaque, but they are available, but you can use glasses, amber glasses to reduce the amount of blue light exposure. So, but being very careful about your brain health at night and making sure that you have darkness when it's time to go to sleep. Just another aspect of the social rhythm therapy. Again, this is all addressed in the workbook. It's important to think about social rhythm disruptions. Like, that's normal. Life's normal. Stuff happens. And we want to be intentional about how we address them. And so we think about both planned disruptions, so an upcoming vacation, or you're inviting some house guests, or that we're going to switch from daylight savings times to standard time or vice versa, or you've got your student and you've got exams coming up, or maybe some of this is going to be unplanned, like stuff that we can't anticipate. You spend the night in the emergency room because you're sick, or caring for someone who's sick, or somebody shows up on your doorstep and is staying with you, or work throws something at you and you have to stay up late to get it done. So we want to spend some time thinking about what can, once we've gotten our clock stable, like what can happen to mess it up, and thinking through some strategies to protect ourselves in the face of both planned and unplanned disruptions. And so, again, here's a bunch of examples. Again, this is coming out of that workbook. But, the first thing to do is just kind of to anticipate them and think about them and sort of think through the implications of especially a planned disruption, but also kind of brainstorming about what are some things that could happen. Generally, we would, when you know that a time change is happening, we would recommend shifting your schedule gradually in advance of the time. This is really useful if you're traveling across time zones, for instance. And so again, you don't want to like jar your circadian system. So if you can just gradually, really over a couple of weeks, if possible, sort of shift your body clock, that's a protective strategy you could use. Another strategy is, maybe like you go on vacation and you're going to get up a little bit later than usual, but maybe you can still have dinner at the same time. Maybe, you're not going to work, but maybe you could, plan a vacation activity at the same time, so that, you keep some aspects of your schedule the same. In the face of an unplanned event, the goal here is to get back on track as soon as possible. So like you spend the night, studying, you take your exam and you want to go to sleep, right? But ideally, you could take a 20-minute power nap, but you want to stay up so that you go to bed at your usual time and get back on track, get back on those routines as soon as possible. Light is helpful. Remember, that's a really potent factor. So you want to get, light as soon as possible in the morning, and dark at night, to kind of, again, remind your brain when it is, and always rely on social supports to help you if you're struggling with disruptions. Again, this is good for everybody. So if you live with other people, maybe you can kind of convince them to get in on the action, because, really this has benefit for everyone, whether or not, you struggle with mood disorders. I don't really have time to talk about this, but I think, so this is a silly cartoon. I like that. It's from the New Yorker. I like New Yorkers. It says, now that the kids are in jail, maybe we can take that vacation we always wanted to take. So, the meta message here is that your relationships, your social structures affect your routines and rhythms. So paying attention to your relationships, taking care of them, but also thinking about when you do things with other people, when you don't do things with other people, how that's affecting your routines, and how you can leverage those relationships in order to ensure stability of your body clocks. So I'm just wrapping up now so that we'll have a couple minutes for questions. Just kind of my take-home points here would be, look, regular routines stabilize mood. The pathway to get to stability, everybody's going to find their own journey. There are a lot of pathways forward. That's the good news. We use the social rhythm metric as a way to kind of systematize that and allow us to identify and then modify maladaptive patterns, and link that to mood and to energy. I've said it before, I'll say it again, a regular wake up time, that's going to set your days. So if you want to pick one thing to work on, that would be it. And, pay attention to your relationships. They're important for your psychological health, but they also have an important indirect effect on your mood by affecting your routines. And so I just want to draw your attention to two books. The one on the right, the Social Rhythm Therapy Workbook, is the one that I recently published, and it's available on Amazon if you want to pick that up. It's a self-guided workbook with kind of scaffolded exercise, a lot of the stuff that I was talking about. The original so Interpersonal and Social Rhythm Therapy Manual is the one on the left by Ellen Frank, that was published in 2005. It's written for therapists, so it's a clinician's guide. But whether you're a clinician or not, there's like a lot of tips and pearls in there on how to manage daily routines, and also include some of the interpersonal component of the full package of IPSRT. So I am going to stop sharing, and I'd be happy to answer questions.
Dr. Swartz, thank you so much for that presentation. And as Dr. Swartz just said, we will be moving into the question and answer portion of today's talk. So please type your questions in the chat box. We're going to get to as many as we can during this period. And our first question is, does sunlight through a window or from a light box count for bright light during wake up?
Yeah, no, that's a great question. I think any light counts. And so there are some windows that have been treated with a glaze that subtract out the blue spectrum light. So if you've got really fancy high-end windows, that might be an issue, in which case you just open the window up. A light box is very potent. Light therapy is used as a treatment, as most of you know, for depression and also for bipolar depression. You want to be careful about that, because that's like a huge pulse of light. So it's usually 7,000 or 10,000 lux. And actually the recommendation in bipolar disorder, if you're treating bipolar depression, is actually to use the light box midday rather than first thing in the morning. So it's a pretty intense bout of light. So, in general, I think getting ambient light, the current recommendation is getting at least 2 hours of ambient light a day, whether it's sitting on your porch, opening your window. If you have old windows, just look out the window, that's fine too. So I think light therapy is kind of a different beast. And you want to be careful about it, because it actually can induce mania if you're not careful. But ambient light is good for everybody. And hopefully there are a lot of ways to get it. If it's cloudy, you still get the blue spectrum light.
It's good to know. And so our next question is in regards to wake up time. And is it enough to count as vertical if it's sitting up in a chair opposed to standing?
Look, you do what you can. Ideally you would want to be fully vertical, because it's your whole body that determines essentially your blood pressure, which tells your brain that you're vertical. Sitting up in a chair is better than laying down, and so you start where with what you can do. I think ultimately, if you're getting a little bit more energy and can move from seated to like standing up and walking around for a little bit, that's even better. But sitting up, that's a great start.
And so our next question is exercise or physical activity something that is looked at in social rhythm therapy?
Yeah, no, that's a great question. We know that exercise is important for all of us, for our health, for our physical health, and for our mental health. The version of the SRM that's in my workbook and that we've often used clinically allows you to customize 2 items. So for many people choose to put in exercise and track that and try to do that at the same time every day. In the original trials, that was an optional item. I think maybe knowing what we know now, maybe we would have put it in as a mandatory item. But of course, some people find exercise to be challenging, especially when you're depressed. So, I think if that's an important part of your life and your routines, definitely track it. Try to do it at the same time every day. And, so the general message is exercise is good for us. When we're depressed, it might be harder to do, but that could be something to work towards.
Thank you. So our next question is there a recommended time for caffeine consumption to be ended?
Yeah, so caffeine has a half-life of about 5 hours. People vary in their sensitivity to caffeine. half life means that half of it is gone after 5 hours. So, um, you know, a good rule of thumb would be, maybe 3 o'clock in the afternoon, but some people are more sensitive. So, you can experiment with it, and maybe some people, need to kind of get it out of, cut themselves off at about noon. But just keeping in mind that it sticks around for a while, even after you've finished drinking your coffee. And so it's still in your system, a good many hours later. So maybe 3 o'clock.
Okay. And then so our next question is, how do diagnosed sleep disorders affect SRT?
Yeah, that's a super important question. So, I mean, sleep health is one part of social rhythm therapy. And, if you have some kind of sleep disorder that's interfering with your sleep, it's going to be hard to establish other stable routines. Certainly, my first recommendation would be to work with a sleep medicine specialist. For instance, if you have sleep apnea, to get that addressed. Use a CPAP machine, for instance, so that you're able to better sleep through the night. The strategies that if you have the strategies that we recommend are not going to be a problem or at odds with management of a sleep disorder. It just might be harder to get on a fully regular schedule if you're experiencing some kind of sleep disorder that really interferes with your ability to sleep at night.
And so our next question is, when it comes to rating your mood and energy levels, do you do that before you go to bed the day of or the next day?
Yeah, so that's a great question. I think everybody figures out a system that works for themselves, but like one, sort of a general strategy would be like just to like put it at your bedside, and as you're getting ready to go to bed, just, do we try to do it for an average for the day, like just do your average rating for the day, as you're, getting yourself ready for bed. That works for a lot of people. Um, some people prefer, who are maybe more of a morning lark than a night owl, might prefer just to like do it retrospectively from the prior day, first thing in the morning when they get up, because they're too tired at night to sort of deal with it. But again, I think that the idea here is consistency. So, try to pick a time that works for you, and just, fairly consistently complete the SRM at the same time every day, the mood ratings. And, you can do the other ratings as the day goes on if you carry it around with you. A lot of people will just kind of do it in the evening and just put them all in, towards the end of the day.
That's great. And our next question is, what's the difference between go to sleep and go to bed?
Well, time that you go to bed is the time that you turn the lights out, you're horizontal, you're planning to, go to sleep for the night. So that's the time you go to bed. The time that you fall asleep, if you're experiencing insomnia, like you could be tossing and turning in bed with the lights off for 30 minutes, an hour. So the SRM is not tracking that disconnection between time to bed and time actually asleep. And there, for some people, there may be a gap, and that may end up being something that you choose to track as well. But we're focusing on, in the SRT stuff, on behavioral things that you can do. So time to bed, turn the lights off, get horizontal, get rid of noises, turn off all your devices. So those are the behavioral things that you can do to go to bed.
Well, thank you. And so we have time for one more question today, and that is, with unplanned social rhythm disruptions, how can we restabilize earlier rather than later?
Yeah, I mean, I think, again, the whole nature of an unplanned disruption is it's unplanned. So sometimes you're having to improvise on the fly. But again, the things that you can always do are try to pick out at least some of your rhythms that you can stick to. Maybe your meal times, maybe it's, if you exercise, your exercise time, the time that you go to bed. You might be able to, so try to preserve what you can, even in the face of, the disruption. And, again, self-compassion. Sometimes the shit hits the fan, excuse me. And you're going to do what you got to do. But ultimately, I think that whoever asked the question, you're right. You want to do it as soon as possible. So try to get back onto your schedule as soon as that would allow. Ask other people to help out so that you can protect your brain.
Mhm. Well, Dr. Swartz, I want to thank you so much for joining us today and sharing your knowledge on SRT. And I do want to let everyone know that the Social Rhythm Therapy Workbook for Bipolar Disorder is a great resource to have. And if you would like the link to that, you can find it on Amazon or email info@ibpf.org. And this webinar will be available to be rewatched on ibpf.org and on our YouTube channel at International Bipolar Foundation. And Dr. Swartz, I'd like to ask if you have any closing comments.
I want to thank you for inviting me, and it's been really a pleasure. Thank you so much.
Of course. Thank you, Dr. Swartz, and everyone. Have a lovely rest of your day.